Hi everyone, welcome to Center of Balance Live. I'm Sinan Pua from Center of Balance, the acupuncturist. Now tonight's a bit late for about 10:20 now. So this is the time that I'm going to do a live video for you. In this live video, we're going to focus on tinnitus. Now tinnitus, well, this is a very difficult case. Very difficult case for a lot of practitioners, right? And a lot of people actually suffer from tinnitus and they don't have any solution for it. So tonight we're going to focus on tinnitus. Now, if you suffer from tinnitus, then I want to let you know that acupuncture may be the best solution for you, and as well as Chinese medicines. Hi, Tanya. Nice to meet you. Thank you for supporting. Hi, Veronica. Thank you for supporting. It's a night time for you, and it's a morning for you. Yeah, it's night time for me. Hi, Eric. How are you? Thank you for supporting. Now, if you're up on Facebook right now, please give me a thumbs up and say hi to me. And then the next thing I want you to do is share this live video. Share this live video. If you're on YouTube, please give me a thumbs up and subscribe to this live video, my channel, and as well as ring the bell. Right now, I'm on my let's have a look, Instagram, and I'm gonna do the Instagram live as well. All right. Now, if you're on my clinic page, right, I actually do it on my Facebook clinic page, and if you suffer from tinnitus, which is ringing sound in your ear, here's the phone number that you can call us so we can help you. 078467956, 078467956. All right, thank you. Now, I recently have a case. Last week came here for 4 a.m. for America. That's very early. Thank you. Okay, so so this patient actually have ringing sound, and that ringing sound is very different, because most ringing sound is tinnitus is when you're at nighttime when you're quiet, it's louder. But this patient is when she hears someone talk, or there's music, when there's noise, and the tinnitus, the ringing sound in the ear actually get high pitch, and to a state that she felt very annoying, very annoying. And before that, she actually suffered from dizziness. It's a dizziness that come with the tinnitus. Unfortunately, they haven't figured out what's going on, and I suspect that this may be the mania disease, because it's very often the mania disease that's causing tinnitus, right? And even causing that hearing loss. Then unfortunately, she hasn't got any test for that, right? But anyway, for acupuncture, we have few strategy I want to introduce to you tonight. So one of the things that we call the few acupuncture strategy that I have been trying, that's been working for tinnitus, right? And I would be honest to you, even acupuncture, then I try to figure it out for years and years. And I asked a lot of practitioners and a lot of master, and none of them actually would tell you, hey Sinan, I have 100% results for tinnitus. And I have to be honest to you, I don't do 100% either. Well, which means tinnitus is the hardest conditions for all the practitioner, and it's very difficult to treat, right? And one of the things that may help you, right, is white noise. The white noise, which you can buy a white noise machine, then you plug it in all day. When you go to sleep, you play it, and you hear some zzz, that kind of sound, then it helps you actually go to sleep. Okay, and I have some patient with tinnitus at nighttime. They couldn't go to sleep. What they do is they actually turn on the radio, just play the radio all night and go to sleep. Wow. Now this doesn't work for everyone, but I know some people actually get this to help them to go to sleep. Now, if you try all sort of things that you find it doesn't help you, hey, you might as well try the acupuncture, because acupuncture might be the answer for you, might be the solution for you. And I have to tell you that I worked out that few acupuncture technique that will work for tinnitus. And so far, when I work for all this tinnitus patients, they all respond to my acupuncture. Now, I actually have to test it out, which one work for them. And I will share with you right now and here. So one of the technique is trigger point technique, which is you guys hear a lot about it, joint needling techniques. So as I told you that joint needling technique is based on trigger point. And trigger point is what we've been using for 1,000 years. This theory is already in acupuncture theory, right? Traditional acupuncture theory. Now, I use trigger point theory and trigger point technique on this is because I have a master who in Hong Kong, and she actually did acupuncture for neck pain patient, tightness in the neck. Then the patient came back, told him that his tinnitus got much better, much better. Therefore, this patient actually introduced a lot of other patients came to him for acupuncture to help tinnitus. And I actually went to attend this master workshop, and I actually invited him to come to New Zealand to learn from him. And we have quite a few acupuncturists actually learn from this master. And I actually asked the master, well, do you actually, will you be able to fix all the tinnitus patient? He said, no. The answer is no. He only able to fix some of them if the tinnitus is causing from the neck problem. So now I know, ever since that, I know some tinnitus is actually causing from the neck pain, neck stiffness, which means it's the muscle and here or there that tightening up and causing tinnitus. Then this is the only way. This is the way. This is, if you find out the patient have the tightness in the neck or stiffness in the neck, and you want to relieve the neck pain and the muscle in here or on here on the scalp and the neck using trigger point technique in theory, then they may help tinnitus. Okay, apart from that, according to Chinese medicines, the theory of the organs that may cause from kidney, because kidney control the ear, right? Kidney control the ear. Is the problems from kidney? This is gonna be difficult case. Then what do? We actually do. Hi, happy day. How are you? I'm good, thank you. And Rose, thank you. Acupuncture can help people who with problem of tinnitus. Yes, I agree with that. Okay, now When it comes to kidney, that is the difficult one, very difficult one. Now, what technique do I use? I use acupuncture, which I take the pulse and I go and nourishing the kidney function. Now, kidney yang, kidney water, or Mingmen, kidney water, kidney in, or kidney yang, Mingmen. Those two organs, we need two kidneys, but different functions. We need to figure out which one causing the problem. Then we balance it, then that will help. So what I use is only 1 or 2 needles and with Chinese herbs, and that would help. Okay, I've tried on my patient. I put needle in, I just stay there and feel the pulse again. And the pulse, once the pulse become balanced, and I ask the patient, how is the tinnitus right now? And they say, wow, that is decreasing. I hear less, and I know it's working, right? So another thing that in here, if it's not causing from the kidney and bladder, it's causing for any other organs in here, because those out of balance that causing kidney have the ear conditions. Then therefore, in this condition, we're going to treat what? Again, treat the other organs by using pulse to diagnose, make the diagnosis, and according to diagnosis, we place the needles. That is one of my methods to treat tinnitus, which is called acupuncture spirit. I have another technique, which is treating the organs as well as the meridian, which is using true scalp acupuncture. True scalp acupuncture, which we place needle over here, in here, and according to the other symptom that patient have, and put some organs area over here. Then while the true scalp acupuncture in, I actually add on balance method acupuncture on the hands and let me show you hands and legs, right? Hands and legs over here, 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 and here are actually able to balance the meridian around the ear. So we have few main ear point, which meridian, which is sanjiao, small intestine, gallbladder. So sanjiao is kidney yang function meridian. So those 3 meridian that I can use here, 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 and here to balance, right? A bit more needles because I place a needle on the scalp, the needle here, 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 and sometimes we put needle over the ear, around here 3 point and here, right? Sometimes we don't need to work on the ear and it will work. So this is another technique, that strategy that I use for tinnitus, and it works. Further on, I actually combine those techniques together. Which means I may do the trigger point first, and I do balance method acupuncture and plus scalp. I work out this combination if that works for patient, and next time I'll do different trigger point with acupuncture spirit and see which one works better for patient, right? If the patient hasn't got any neck issue, pain, they just have tightness, I will still go with trigger point. With the trigger point, if it works instantly. If it doesn't work, it doesn't work. So I'll forget about the trigger point technique. So I'll stop using trigger point technique and I'll go with just balance method acupuncture, with true scalp acupuncture, or with acupuncture spirit. Now, another technique that is I've been using, and actually not trigger point technique, which is not dry needling. I use GE acupuncture, and GE acupuncture is very, very different with the other techniques. And it looked at your feet to look at whether which feet is shorter or rotation imbalance. If I be able to find out the rotation imbalance or which leg is shorter or which leg is longer, then I will be able to figure out which point around your head or hands and legs to place a needle in. And I just need few needles in, and it'll instantly give you relief from the tinnitus, right? So this is some of the technique that I can actually help. Those I've been testing out for my patient. They all work, but it doesn't mean one technique can heal the tinnitus patient. Okay, it can be a combination. What I mean combination is neck problem plus organs imbalance plus the structure imbalance, that a combination causes the tinnitus. Therefore, we need to combine Chinese herbs, GE acupuncture, or acupuncture spirit, balance method acupuncture, combined together to help the patient recover from the tinnitus. I actually have a patient last month who actually suffered from mania, and she lost her hearing. The hearing back to nothing. She can't hear anything. And with GE acupuncture, with acupuncture spirit, and I actually got her hearing all back to normal, and the dizziness all gone, right? So this is fantastic because her specialist told her that that hearing loss is not gonna get back because this is a nerve damage. It is common with mania disease. One is to give you ear tinnitus as well as hearing loss, and it can be a permanent issue. If you suffer from this problem, you get an acupuncturist to help you, you may recover very well. Like this patient, she just started for about 2 or 3 weeks, and she came in here to find to seek for treatment, and I got her. I put needle in and I help her to recover. She can hear again. Right? Stay awesome, and I love you all. Last nutrition 14 is good to reduce tinnitus. Good to know. Thank you, Eric. Well, any point, as long as if you have any experience with that, you need to combine it and figure it out. If your practitioner figure out what point help which patient, what sort of patient would benefit from it, right? Like I figured out that GE acupuncture, which is structure acupuncture, and trigger point acupuncture will definitely work for patients that have tight neck or headaches and with tinnitus, and this will help. Other than that, if they don't have these conditions, GE acupuncture or especially trigger point dry needling, they won't help at all, or they only help a little bit. Right? Stay awesome, and I love you all. I'll see you next time. Thank you very much. Oh, a lot of people in YouTube as well. Thank you. I didn't see you guys. Thank you again. Maria, Ben from Perth. Thank you for joining us. Judy, happy day as well. Good morning, Judy. Yeah. Aimin from Kazakhstan. Thank you. Thank you.